Hello, I'm Dr. Kenneth Iguda, a specialist in reproductive medicine. Today, my consideration or thoughts are whether you will prefer a day 3 or day 5 embryo transfers. Over the years, as I practice assisted reproduction technology, one of the questions that my client pose at me often is, when are we having our transfers? A whole lot of them show concern or desire towards having a day 5 embryo transfer against the day 3 embryo transfers. Are there benefits of a day 3 embryo transfers, or are there more benefits having a day 5 embryo transfer? The 3 embryo transfer, you have the cells still dividing and they are in a more primitive state compared to the day 5 embryo transfer, where you have the embryos at the blastocyst stage. That's a stage where it's very close to achieving implantation, hatching and achieving implantation. The benefit of a day 5 embryo transfer is you have the opportunity or privilege of seeing the stages of development that this embryo is going through and the eventual quality that this embryo attains before it's transferred. An embryo that is transferred on day 3 would not have been studied far enough to understand how good it would be by day 5, for instance. And not many day 3 embryos have the ability of attaining day 5 blastocyst quality. As a result of that, most clinicians want to satisfy their conscience or satisfy their curiosity in ensuring that the best looking embryo morphologically is transferred. You may not have that ability to make that decision on a day 3 transfer. For those who do embryo biopsy, taking a biopsy of an embryo on a day 5, it's more important than taking a biopsy on a day 3, because you have more cells at the day 5 period than day 3, where you have just about 8 cells. And so there's less alteration that's likely going to be done to an embryo when a biopsy is taken on the day 5. But clinically, there has been no significant difference in the rate of achieving pregnancy following the 3 or the 5 transfers. So for some reason, I would say I don't care, or I really don't mind if a day 3 transfer is done or a day 5. But for some other reason, like especially taking of embryo biopsy for pre-implantation genetic diagnosis, when you're dealing with genetic diseases that could be transferred to an offspring, I would prefer a day 5 biopsy taken. And of course, if a day 5 biopsy is taken, automatically you're going to have a blastocyst transfer. So they both have their pros and cons depending on what kind of treatment is being considered. But as for achieving pregnancy, researches have not shown significant difference in the clinical pregnancy rate following the 3 or the 5 transfer. You could get this and more on our website, or even still visit our facilities. Until I come your way next time, I remain Kenneth, your reproductive medicine specialist. Thank you for viewing.